That is a great question because it reminds us that a person with ITP is not living in a vacuum. Life goes on around the person. Other situations or conditions may be influencing that person's health and may impact their ITP and whether they have bleeding or not. In fact, there are some situations that could even cause a person with ITP to have the opposite happen, to have a clotting episode. So we have to be very, very aware of everything that's going on with that patient of ours with ITP, especially if the other medical condition or conditions leads to the need for a diagnostic procedure. So invasive diagnostic procedures, do put patients at risk for both bleeding and clotting, depending on the nature of the procedure. So we have to be very aware of that in the patient with a low platelet count due to ITP. So usually our approach is to be sensitive to that and to correct the platelet count to a level that would allow for them to go through the procedure without excess bleeding. Keeping in mind, though, that too much correction and causing the platelet count to rise too much could create a situation where they're at more risk for clotting. So we have to avoid that. And we have to really tailor the medical therapy to prepare a person for a procedure, not to overshoot. So usually for a minor procedure, if we get the patient's platelet count between 50 and 100,000, it usually affords them good hemostasis without a lot of excess risk for having a blood clot. For more major procedures, we try to get the platelet count usually around or greater than 100,000, just over 100,000, and not to exceed that by too much because A, it's not necessary, and B, too much correction could put the patient at risk for a clotting episode.